Hi, good morning. It's Ask Dr. Ben. Yeah, recording from the home studio. Wow. Yeah, amazing. Okay, let's do the first question, which is from Hazel. Good morning, Hazel. All right, question is, hi again. Hello. Very interesting to read about the longevity of antibodies. Yeah, or lack thereof. Yes. Given my last question was about my own experience with this, testing positive then negative for antibodies. My question is this the case? Why, if this is the case, why aren't we seeing biphasic cases appear where you like get it and then get it again? Yeah. Or have our T cells developed a defense to ward it off the second time rather than an antibody defense? Now that is possible, and that is certainly something that could work, but it's not something that I think we can rely on necessarily. Right now, it's very, very difficult to tell the first time you've had it from the second time you've had it because there isn't a good way to actually prove that the virus was ever gone, that it ever left you. And there are some exceptional cases where people are holding on to the virus for months. And so, yeah, could one of these cases be, behind any of these reports of people getting it twice? It's possible. It's not certain, but it's possible. I think if we have a case where we have like a year delay between the first time you're positive and then, total picture of health for a year and then another case, at that point I would think we could say, yeah, this is definitely a re-exposure. And particularly if you had, if somebody had done a genetic sequence of the virus from the first time, and you can look at the genetic sequence of the second time and show that it is more related to whatever is circulating then rather than whatever was circulating, because the virus wouldn't have taken the exact same evolutionary path inside someone's body that it takes in the world necessarily. So that's the thinking there. But yeah, it's very, very rare where you can get enough tests to even confirm that you are actually negative. It's extremely rare that a virus from inside you would ever actually be sequenced because it's kind of expensive. But this data is gold dust. It is very, very useful to have in terms of tracking exactly what's going on. This is the forensic evidence that lets you figure out exactly what's going on in the virus puzzle. So that's the best answer I can give. Thanks very much for that question. Yeah, we don't know that there's anything more to it, but there will be other components of the immune system that are kind of harder to assay that will be playing some role. It's just that that has not been looked at in as much detail. For a few people, and I think one of the vaccine trials, they have actually looked at this, but it's not a thing that you can easily do on lots of people. Or it's not easy, but you can with enough money and a real desire to do it, I would say. But it's important information as well. So thank you very much. That was a very good question. This has been Asked Dr. Ben.